COVID-19 and HIV/AIDS. Global Concerns, Prevention and Control. Prepared by D.A. Salem, Director of the International Institute of Risk Management Sciences. So far, only corticosteroids have been shown to be effective against severe and critical forms of COVID-19. Previously, on July 4, 2020, the World Health Organization accepted the recommendation of the International Steering Committee of its Solidarity trial to end the hydroxychloroquine and lopinavir/ritonavir arms of the trial. The International Steering Committee had made its recommendation based on the evidence for treatment with hydroxychloroquine or lopinavir/ritonavir versus standard of care obtained in the interim results of its Solidarity trial, as well as a review of evidence from all trials presented at the World Health Organization Summit July 1–2, 2020 on COVID-19 research and innovation. These interim results showed that hydroxychloroquine and lopinavir/ritonavir resulted in little or no reduction in the mortality of hospitalized COVID-19 patients compared to standard care. The researchers of the clinical trial, Solidarity, have definitively stopped the current trials. For each of the drugs, the interim results did not provide strong evidence of increased mortality. However, a few safety signals were identified in the laboratory results of the Discovery complementary trial, part of the Solidarity trial. These will also be reported in the publication, which will be made in a peer-reviewed journal. This decision only applies to the conduct of the Solidarity trial in hospitalized patients and does not affect the possible evaluation, in other studies, of hydroxychloroquine or the lopinavir combination, ritonavir as treatment options in outpatients or in pre- or post-exposure prophylaxis for COVID-19. In 2020, the COVID-19 pandemic monopolized the attention of the world. This health crisis provided a new example of the close links existing between health and the reduction of inequalities or even human rights. More than 30 years of fighting HIV/AIDS have demonstrated how inequalities have continued to fuel the epidemic. The fight against the AIDS virus thus constantly questions the place of humans in society and health systems. People living with HIV in a very precarious situation are now paying a heavy price for a health crisis that has seriously deteriorated their living conditions. We fear that they will find themselves even more on the front line when it comes to HIV/AIDS in this context of increased vulnerability, said Florence Thurnay, CEO of Side Action. To end the concurrent HIV and COVID-19 pandemics, it is therefore essential to eliminate stigma and discrimination and to put people at the center of the action.
Our world has changed. 9 months ago in Lyon, France, we were celebrating the success of the Global Fund's successful replenishment, $14 billion, not just the largest ever fundraising for the Global Fund, but the largest ever fundraising in global health. This success meant we could increase country allocations for the next 3-year grant cycle by 23.4%, with, as always, 50% of the money going to the fight against HIV. So we entered 2020 excited at the prospect of stepping up the fight, getting back on track towards ending the epidemic by 2030. scaling up prevention programs, reinforcing differentiated service provision, tackling human rights-related barriers to access, accelerating the rollout of innovative approaches such as self-testing and PrEP. I was preparing to come to AIDS 2020 with an ambitious and optimistic analysis of what we needed to do to meet our 2030 goals for HIV and break the back of the AIDS pandemic. And then came COVID-19, and everything changed. In the same way that AIDS changed the world of global health some decades ago, COVID-19 is changing it now. We, the HIV/AIDS community, were the innovators and shapers, pioneering through community-led activism, breaking new ground in how science and communities interact, tackling the stigma and marginalization that drove and still drives the epidemic, mobilizing resources on a scale the world hadn't seen before to respond to the pandemic. The last pandemic to strike humanity before the short-lived H1N1 and now COVID-19. The Global Fund was a product of that extraordinary moment of global solidarity, that burst of energy and leadership, a unique global private-public partnership to fight HIV, to fight TB, and to fight malaria, the three biggest infectious disease killers. Now, with the fight against HIV as yet unfinished, we've been confronted by a new pandemic. The direct impact of COVID-19 is scary enough. In the first 6 months of 2020, COVID-19 has killed over 500,000 people across the world. That's more, maybe a third more, than the number that we would have expected to see die from HIV and AIDS over the same period. But making it worse is the knock-on impact. COVID-19 is derailing the fight against HIV in multiple ways. By disrupting HIV-positive people's access to life-saving antiretroviral treatment. By disruption, prevention and testing programs. By attacking people who are already immunocompromised. By exacerbating the poverty and exclusion of the key populations most vulnerable to HIV. You'll have seen the analyses from UNAIDS and others on the potential effect of COVID-19 on deaths from HIV and other diseases. We could see deaths from HIV and AIDS in sub-Saharan Africa double over the next 12 months. That would take us back to the level of deaths last seen in 2008, 12 years ago. All that extraordinary effort wasted, all those lives, all those billions of dollars, this would be a disaster. We cannot let that happen. We must protect the gains we have made. We must continue to step up the fight. There's too much at stake. It's not just the hundreds of thousands of lives we might lose over the next 12 months. It's the many more lives we would lose, families we would see destroyed, communities ravaged over the years to follow. In the fight against HIV, every step is hard won. We cannot go backwards. The longer-term consequences become starkly evident when you consider, as just one example, the potential impact of disruption to prevention of mother-to-child transmission programs. Analysis by the HIV Modeling Consortium suggests that the ending of PMTCT activities could see the number of new child infections increase by 37% in Mozambique, 78% in Malawi, 104% in Uganda. Other analyses suggest interruption of prevention programs could see new infections spike by 25%. To be able to counter this potentially catastrophic knock-on impact from COVID-19, we must know what's happening on the ground. At the Global Fund, we draw on multiple sources, including our own monitoring tool, a bi-weekly qualitative survey covering over 100 countries in which the Global Fund invests. The latest results, dating from the 15th of June, suggest 80% of the HIV programs we support are suffering disruption, of which 21% are suffering high or very high levels of disruption. What's happening in Zimbabwe illustrates what such disruption means in practice. Data from a recent survey reveals 19% of people on ART are unable to get a complete ARV refill, a 21% decline in HIV testing in the first quarter, and then a 70% further reduction during lockdown, a 78% reduction in PrEP initiations. This is Zimbabwe, a country with one of the most well-run, effective, and successful HIV/AIDS programs in Africa. The Global Fund has reacted swiftly to support countries and communities in responding to these challenges. At the beginning of March, we introduced grant flexibilities to enable countries to utilize funds from grant savings and reprogramming. In April, we launched the COVID-19 response mechanism, known as C19RM. In total, we have made up to $1 billion available. So far, 96 countries and 8 regional programs have used $369 million across these two mechanisms. Our support is focused on 4 areas: helping countries and communities adapt HIV, TB, and malaria programs to mitigate the impact of COVID-19 and to safeguard progress; helping protect frontline health workers through providing personal protective equipment and training; reinforcing systems for health so they don't collapse; and helping countries fight COVID-19 itself. All 4 elements are crucial to protecting the gains and sustaining the momentum in the fight against HIV. HIV prevention, testing, and treatment programs need urgent redesign, including changing treatment distribution models, shifting to multi-month dispensing and direct delivery of ARVs to minimize exposure to infection, adopting digital solutions for service delivery, reducing dependence on face-to-face interaction, expanding self-testing and community-based testing. Frontline workers, including community volunteers serving key populations, must get protective equipment and training. We cannot afford to lose them. We cannot let them become unwitting vectors of transmission. Weaknesses in health systems need urgent fixing. For example, laboratories already overstretched with viral load testing and TB diagnosis are now being swamped with COVID-19 testing. And it's the viral load and TB testing that's getting squeezed out. Containing the spread of COVID-19 is key to avoiding the whole health system being overwhelmed, which would be disastrous to those with HIV.
See you soon.